Darcy, should we start?
I think, yeah, we can probably go ahead and get started. So welcome, everybody. Thank you so much for joining us to talk about this article that was published in Open Forum Infectious Diseases, wondering if I'd get there quicker if I was a man, factors contributing to delayed academic advancement of women in infectious diseases. I am Darcy Wooten, pronouns she, her, and I will be presenting this article with my co-facilitator, Dr. Sara Gianella, who I wanted to just start the meeting by acknowledging and giving gratitude for Dr. Gianella, who has really done a lot of the heavy lifting and a lot of the work in this space of gender equity within our division and across the institution as well. And it's such an honor and privilege to be able to sort of be a supporting actress today with her, and especially on International Women's Day. So with that, we'll go ahead and move to the next slide.
Okay.
And here is just an overview of the article and what we'll be covering. So I will review the methods and the study participants, and then Dr. Gianella will go through the results and discussion, and then hopefully open things up for discussion among all of us of really how can we bring this and make change here locally at our institution. Next. So we wanted to start with a couple of disclaimers. First and foremost, really acknowledging that gender is really only one of the important factors that can negatively impact academic advancement, but there are many other identities and factors along with their intersectionalities that can really make it difficult for people to have equitable access to a variety of things, including academic promotion and the things that we'll discuss here. Because of scope and just lack of time, we're focusing on gender, but wanted to acknowledge that there are definitely other factors at play as well. We also wanted to recognize the importance of male allyship, and really topics like this can be very divisive. And what we're hoping is that we actually are performing the opposite of that with this discussion, and really not singling anybody or any group out, but really inviting everybody to help address this critically important issue of gender disparities. Also wanted to acknowledge that the conversation and the way that we'll present this is really going to model how the topic was discussed in the article, which is in a very binary fashion of cisgender women and cisgender men, realizing that we're not even starting the conversation on non-binary individuals and trans individuals. So just wanted to acknowledge that as well. And then I served as the editor for this article, and Sara was a reviewer, so wanted to give that disclosure. And lastly, I will say that I am not an expert in gender disparities. I am flying by the seat of my lived experience here, but very passionate, like so many of us are, about this topic. Next. So we'll start with some background. Everybody here is well aware of the gaps in academic advancement between men and women. And these are large gaps, but not only are they large, but also persistent. And this is not only in academic medicine, but in infectious diseases specifically. The article cited an 8% adjusted disparity in the rate of advancement to full professorship when you control for the variety of factors and confounders that could contribute to these disparities. So when you control for all those things, there's still this gap. We know that women are less likely to be promoted to associate or full professor. And the thing that's really disheartening is that this isn't getting better over time. These are very long-standing observations and realities. And because of that, we really wanted to bring this article and this topic to our group and beyond to really heighten the sense of urgency that this is something that we don't really have the privilege to wait around. We need to address this now and make changes, because the longer these disparities stay in place, the more difficult they are to change. Next. So we don't have time for a comprehensive review of the literature on this topic. These are just a few of the many, many articles that have been published in the last year and really over the last several years, really documenting the disparities in things like rank and tenure among faculty between men and women, differences in salary, differences in earning potential, differences in numbers of publications, when you control for other factors and receiving credit for contributions to science. So we don't have time to review these, and a lot of these papers really focus on the predictors and the quantitative aspects of these disparities. And as we get into the article, we'll see taking a qualitative approach to really drill down on some of the nuances to help inform some of the solutions. Next. I do think it's helpful to review two key experiences and reflect on our own experiences here at UCSD, because this really will contextualize the conversation in terms of what changes we can make here. So the first set of surveys that I wanted to highlight, people are probably familiar with, but just to review in case you aren't, were the Department of Medicine faculty climate surveys that came out in 2015 and 2019. As most people know, there's a current survey that if you haven't completed it, please do so, because that will be very informative. But the results of these survey, I think, really brought to light a lot of these issues. So in the 2019 survey, men as well as faculty from underrepresented race and ethnicities reported an increase in morale between 2015 and 2019. Women were the only group where the morale actually decreased between these years. Additionally, women in these surveys were more dissatisfied across 8 core areas within their work at UCSD. They also experienced more inappropriate behavior by other faculty and reported that this significantly negatively impacted their work. Women also felt that they received less information and were less informed about compensation, and they also had fewer resources to achieve success, such as space, administrative support, and a number of other factors. Next. The other report that I think is very helpful is another report that many people are probably familiar with from UCSD Health Scientists looking at gender equity that came out in April of 2022. And so while the last report really focused on faculty self-report of these issues, this report includes some hardcore outcomes in terms of what the disparities are. So in this study, they found that there were fewer women in FTE series, fewer women who had endowed chairs, fewer women who were proposed for acceleration, and fewer women who were in faculty leadership positions. And I don't think this is a surprise to anybody, but I think really documenting these is the first step in acknowledging them. Additionally, in this report, they identified that there wasn't really a clear process to report inappropriate behavior or inequities, and there was no unit that was actively responsible in addressing these things. It was a little bit dispersed. And women faculty are paid less compared to men faculty, on average 12%, but this number is larger among different subgroups. Next. And so out of this study, they modeled sort of how long would it take for women to reach parity in this example of women achieving the equivalent amount of FTE appointments. And you can see from this graph that it would take 35 years for women to reach parity. And this is just absolutely mind-blowing and unacceptable that if we keep doing what we're doing, it's going to take 35 years and we're already way far behind. So something needs to be done differently. And that's why we wanted to bring this article to the group. So again, this idea that this isn't urgent is something I want everybody to kind of walk away with, dispelling that myth and really understanding that having patients is a privilege that I don't think any of us can take advantage of, and that we really need to take some urgency and raise this to a level of urgency. Next. When we look at what are the possible factors that contribute to these disparities, again, a lot of this data comes from a multitude of studies and publications from the literature, really that have taken a quantitative approach to this question, but includes things that I don't think will be surprising to anybody. So things like ineffective mentorship, having disparate institutional and salary support for women compared to men. There's also, outside of the work setting, personal and cultural factors such as childcare and domestic responsibilities. Family leave policy is something that I hope we come back to in the discussion, because I think there's some real opportunities there. Women not having training on negotiation skills, feeling imposter syndrome and not self-promoting compared to men. Sexual harassment, and then issues among the leadership. So leadership having implicit or even explicit bias against women, or not having the skills or the training to be able to address disparities. And then broader scale things that always trickle down in terms of structural and systemic sexism within our society. So this is a very complex and multifactorial issue, which means we're going to need a complex and multifactorial solution. And that's where really qualitative research has the opportunity to provide some insight in terms of how to address some of these issues. Next. So the goal of this study was really to identify and characterize perceptions about why gender disparities in academic advancement persist in infectious diseases, and to get ID faculty perceptions and experiences in the academic process. So talking about people's lived experiences. Next. So this was a qualitative study conducted at ID Week, which is our National Infectious Diseases Society of America national meeting. They conducted 4 60-minute in-person focus groups. This was pre-COVID, and recruited people to participate in the focus groups through the IDSA email listserv. The authors ensured to have a good geographic sampling of people across the country, and they asked participants what their academic affiliation was, as well as their current rank. They did not collect data on age, race, or ethnicity. So again, we're not able to kind of have a informed discussion about how these intersectionalities might be playing a role here. Next. The focus groups were arranged by rank. So there was women assistant professor, women associate professor, women full professor, and then there was one group of men full professors. And they arranged the participants into these groups in order to minimize social desirability bias across rank, and hopefully not having an influence on how people would report their experiences. Next. Sorry. So during the interviews, the investigators conducted semi-structured interviews using open-ended questions, looking at what the barriers were to academic advancement, as well as what people would propose as solutions. They recorded the interviews and then transcribed them. Next. Here are some examples of some of the questions. Tell us about aspects of the promotion process at your institution that you feel may make it harder for women to advance academically than men. Next. Why do you think there are so few women at the level of full professor in ID? Next. And how do you feel about your mentorship opportunities and their impact on promotion? Next. So the authors applied content analysis in order to identify and highlight emergent themes. The 2 investigators used an inductive process to develop codes, and then one of the investigators went through and applied these codes to the transcripts. The other investigator then reviewed how the transcripts were coded, and where there was disagreement, they discussed to achieve consensus. And then they independently reviewed the coded transcript and then pulled out these emergent themes. And so that's an overview of the methods, and I'll turn it over to Dr. Gianella to discuss the results and the discussion.
Okay, thank you so much, Darcy. So let's first go on table 1, where you will see basically the composition of the 4 groups. As a reminder, we have one group with assistant professor and instructor. They were all women. It's 14 people. Then we have a second group of associate professor women, 11, full professor women, 12, and then full professor men, 13. And here you can see the breakdown by region. They try to balance it across 4 regions. They also try to balance between, like a larger and smaller hospital, and between pediatric and adult infectious disease, like both were represented, although most of it were adults. Again, I think it's important to note and to keep noting the lack of race and ethnicity data. And so they were unable to perform any intersectionality analysis, which, you know, I feel very strongly should be something that we should be doing more. And I just wanted to highlight this small comment that we wrote in Nature a few months ago to kind of highlight the need of more intersectionality research. Okay, so we have here a table where they summarized the main themes. They were brought, and then we will dig into the 3 main themes, and we will go over some of the, you know, topics and of the quotes that were the main. So obviously we are looking into gender bias contributes to delay in academic advancement. Everyone agreed on that. That balancing demands of family with academic advancement is difficult and most of the time falls on women. Women are less likely than men to be good at negotiating and to self-promote themselves. University metric promotion are not always consistent and in line with the academic tracks. And it looks like in particular with academic physician achievement, a lot of people that take on unpaid citizenship tasks like service and teaching that might delay advancement. And we know that that's often disproportionately falling on women. Also, people felt that policy needs to change from the top, like there needs to be some structural changes, that advancing and promoting transparency is crucial for people to know what they can ask and, you know, to kind of have some clear milestone. You know, people felt that sponsorship, mentorship is important, and in particular, peer mentorship from senior women to junior women should be an important part. Okay, so let's dig a little bit more into the 3 main themes. The first being gender bias contributes to delay in academic advancement. So this was a major theme in all 4 focus groups. And it was addressed significantly more by women than men. And they identified both institutional and interpersonal factors contributing to this gender bias. When we talk about institutional gender bias, like the first one is recruitment bias. This is actually a quote from a man who said, we have 2 tracks and almost all the women are in the non-tenured track, which is true at UCSD, as you remember the 35-year gap to obtain the same level of FTE across genders. So there is some sort of implicit bias when they were hired, that women are placed preferentially in non-tenured track because maybe they couldn't keep it up. And then this is a woman full professor that says when something happens that's egregious, when there's a department chair search committee and there are no women on the committee, I think that has to be called out. Absolutely agree, right? We can't have panels or search committee where we don't have broad representation of, not only genders, but obviously also other factors. Family unfriendly policies. This is an assistant professor. I had my children after I became a faculty, but I was expected to have the exact same productivity the year I took maternity leave. There was no prorating or RVUs or clinical time. I took 8 weeks off because I couldn't possibly squeeze anything else inside of that calendar year and still meet my metrics. And that's another one from an assistant professor. If I choose to nurse, you have a full clinic schedule. There's no pumping time. So you have to make your patients wait, and there is no place for you to pump in the clinic. When I will get to the hospital, the pumping room was so disgusting that I will not go in there. So I think some of us have personal experience here, and we can talk about it. And then this is an associate professor that talks about we are required to attend faculty meetings that are at 7:30 a.m. And if you have 2 kids and they have to be dropped off at 8:30, so that's never going to work. That's now the interpersonal gender bias. That's an important one. It's when assertiveness is interpreted as aggression, the price of gender norm violation. So this is an assistant professor. I get positive reinforcement if I stick to the female role and be nice and sweet and say yes to everything and smile. But then I worry I'm not going to advocate for myself. I'm not going to be assertive because I don't get the same sort of societal positive reinforcement when I act outside gender norm. So this is an important one. So I actually did a little bit of side research about gender bias at work. So I found a lot of data about these two I wanted to share. So men receive and boost interpersonal status after expressing anger, but not women. Like if a man is angry, you know, like people perceive them as more authority, you know, like that they are a better leader. Like with women, it's always negative. And women receive negative personality criticisms, such as being called bossy or even worse, or told to watch their tone in 75 of performance reviews, while merely men rarely do. We can say the same of teaching evaluation, right? Like women are much more likely to get personal comments on teaching evaluation that a man will never do. Another interpersonal gender bias is harassment in the workplace. This is a full professor woman. I've actually been kissed. I had someone blow on my neck during rounds. I got trapped by a dean in his apartment. Another full professor, 2 women were completely intellectually abused by their mentors. Their mentors took credit for their work, and in both situations, the men were their bosses. This is an associate professor. A colleague was having her mid-tenure review in a male-dominated department, and one of the committee members said, "I'm sorry, you're just going to have to speak up. I'm just not hearing you." And midway through her talk, finally stopped and said, "Well, I guess we all know it's a known fact that women's voices don't come across as authoritarian, whatever. So that's why I can't hear you." I think it's very important to note that explicit harassment emerged more often in full professor women. And I think that this is actually one of the few positive notes, that it looks like that sexual harassment were more tolerated back in the days. And now maybe thanks to some anti-harassment policy and the Me Too movement, it's less and less tolerated. I personally, like when I was a resident, it was normal for the men attending to hit on young women. I think that right now, if a man tries to hit my daughter, she will probably eat him alive. So I do see a generational change, but I also see that men that are accused of misogyny or harassment often get just, you know, retired or kind of pushed away and without making it a big deal, which is frustrated. So definitely something that is important. The second theme is balancing demands of family with academic achievement. This was another major theme in all focus groups, but was addressed significantly more often by the younger women, instructor and assistant professor, which makes sense because a lot of women at that stage are the ones that have, you know, the young kids at home, and so they are more challenged. So this is an assistant professor who say that I delayed having a family to the point where I'm 34. So it's dangerous zone for me because I wanted to progress in my career. And now I don't know if I'm going to be able to sustain what I've built. And that's a big fear for me. And this is a man talking. At the highest level of advancement, there is a requirement for international travel and international recognition. It's very hard for people who are the major caregivers in their household, you know, right or wrong, women are more likely to be running the household than men. And so we're not as, you know, less able to travel and, you know, meet people and network. And this is another man talking. Caring for the sick parents fall disproportionately on women too. So it's like a double whammy to get through having the children, and then they get hit by a sick parent. That's another important one, actually, that some of us are experiencing part-time employment. I have a colleague who went part-time because she wanted to be the one to pick up the kids, which basically meant still working, still trying to direct things. she's not part-time in the list. She only gets paid part-time, right? And that happens is the hospital has gotten away with not having to pay her as much. Team 3, women are less likely than men to use negotiation to advance themselves. And this is, again, a major theme in all focus groups, but addressed significantly more often by women at the associate professor stage. And I think this makes also sense, right? Because at mid-career women is where you want to try looking for leadership opportunity to advance yourself, right? You kind of came across the first step where you have to get your K or, you know, like, and now you're really looking for a leadership position. So this is the moment where you have to negotiate. So assistant professor, as we were negotiating for our first job, the only advice my female co-fellow and I were given was from one female attending who told us when she was going for a job, she was told that since her husband was a cardiologist, she didn't need to be paid as much. So they kind of gave her half of a salary. And it's not only about the compensation, but it's really about also career advancement. This is a woman full professor. It's clearly harder for women. Women get grants at the NIH at the same rate as men, but they systematically ask for less money so that they are funded less well. They don't look for retention packages at the same rate. So once they are in a system, they don't get all of these financial bonuses. Of course, like, you know, looking for a retention package means take the time to go and apply somewhere else and go for an interview and come back and risk, you know, and take a risk to kind of pretend you're going somewhere and hope that the university will put together a retention package. Like, why do we have to play this game? Why can we not just pay and retain the people that are the most value without having to force people to do this, which is time consuming and emotionally draining? So women are also less likely to self-nominate. This is an associate professor. Women tend to look at the promotion checklist, and we don't think we are ready until we check every box. The guys are just, it's time to go, let's just try. That's true. Fear that negotiation is aggressive behavior. Women full professor. I don't think women negotiate on their best behalf because they get hung up about modesty issues, about looking too aggressive, when the reality is that you should negotiate and the only power you have is before you sign. Okay, so negotiation and women, it's obviously a big focus that we had actually a very nice workshop by Sonia Norman, who is here at UCSD in the Department of Psychiatry, about you know, tips to negotiate for women. If you didn't attend, you can reach out. We recorded it, and so we can give you the link. It was phenomenal and definitively a lot to learn. Okay, here I put together some proposed solutions. Some of them are from the article and some of them we sneaked in based on our own ideas and experience. So first of all, we need to address intentional gender bias. I know there are like trainings, workshops. We need to shift away from the leadership phenotype. Well, basically, you know, white male are most likely to be in charge. And so people respond better when white male is the one giving the order, right? Takes a lot more mental energy and convincing for a woman to give order. Like, people are less likely to listen and to follow direction when a woman is giving it. Ensuring that women are proportionally represented on search and promotion committees. We actually have to encourage women to apply for leadership position. And this brings us back to the point that I was saying before, that a lot of women do not apply unless they are 100% sure that they qualify. While I think there is some research that men apply to position even if they only hit half of the box, right? And I think that we just need to take the risk sometime, and worst case, you just don't get the position. But if we don't apply, we will never get it. Shift away from outcome-oriented only metrics, just counting the number of paper or grants, both for advancement and for leadership position, but try to take a more holistic approach where we do recognize all of the contribution of the individuals, and maybe we leave some of us a little bit more time if we need more time because of these other factors that hold us back. Offer leadership workshop, coaching opportunities, structured mentorship and sponsorship program. That's something that we are working on proactively as part of the department, and I hope that we will be able to pilot soon. And we do have, our division has a history of structured mentorship, which is very important. But I think that sponsorship is something different from mentorship. And again, I would love to have someone come and present about mentorship and sponsorship, because I went to AAMC Mid-Career Women Developmental Leadership workshop, and they talked very lengthily about mentorship and sponsorship, and I thought it was really interesting. And then more effective harassment policies with very clear consequences and way to report it. So in this slides, we summarize some of the solution more about the family issues. I think that improved parental leave for both parents, birth and not birth, is crucial. And I say not birth, which is most of the time the male, but not always, to break the dynamics by which the women assume the greater burden of childcare from the time of birth. Allowing the dads or the non-birth parents to stay home is not only fair to them, to allow them to bond with the kids and spend time, but also it breaks these dynamics where everyone thinks that it's the woman that has to stay home. Clean and convenient lactation room, revise promotional processes to support all faculties and trainees who decide to grow families by providing, appropriate way to stop the clock and to slow down and adapt the metrics. Offer more virtual opportunities. This is actually, this is one of the good things that came out from COVID, right? Like that we are able to do more virtual conferences and workshop, on-site childcare service, and highly structured and specifically defined job description for part-time faculties. I feel very strongly about this because a part-time position is not a part-time position if everyone keeps emailing you and still asking you to do a million things. So I think that if somebody chooses to be part-time and is paid part-time, then we have to protect their time. Increased transparency. I think that this is very important because when there is no transparent way of, with recruitment and retention packages, women don't even know what to ask, right? I don't know how much my male colleagues got to stay. Like, I think that these packages should be made public, not only the salary, but the entire package. Like, if somebody gets $1 million in discretionary funding, people should know that, right? Because there is some ways to kind of, give people on the side money that nobody knows about. But I do feel that if we know exactly what's available, then we do a better job to negotiate. Teach effective negotiation skill for trainee and junior faculties. That's very important. Proactive distribution of unpaid service and teaching. This is important, and I will show you, I have an article that I really like and I invite everyone to read, that it's not enough to tell women, just say no, because first of all, we rarely say no. And if we say no, there will be another woman who says yes. So I think it really needs to be at the leadership level that this unpaid service and teaching gets equally distributed across all categories. And then utilize a strategic approach to measure gender equity metrics, implement intervention, and track outcomes, which it looks like our department has started to do, and hold leader accountable for lack of improvements. This is the paper, the article that I was saying, that I think it's really well written and informative, that saying no in science isn't enough. And then here is a paper from the paper, like a framework figure that I really liked, that kind of summarizes all of the factors that we already discussed. So I wanted to leave time for discussion, so I don't think we have to go over this again. So the limitations of the paper, we kind of already mentioned it a few times. First of all, is that they were unable to conduct an exhaustive exploration of all barriers to academic advancement, given limited time and resources, and in particular, so we know that Black, Latina, and Indigenous women are more likely to face all of these obstacles, but unfortunately, they did not collect race and ethnicity data, so they were unable to look at it. The sample size was relatively small, and we need more longitudinal studies to track changes. Another obvious limitation is that this entire study was done before COVID. This means it's likely to be much worse, because we know that the COVID pandemic further exacerbated this disparity by decreasing academic and research productivity among women, especially those with young children, because they take on a disproportionate burden of caregiving and homeschooling. I really like this paper that says, where are the women, gender inequality in COVID-19 research authorship? Again, we don't have time to go too much into the details, but I invite people to review this too, because that's important. So the conclusions, the gender gap in academia advancement is pervasive, significant problem in ID. It has not improved despite more women having entered the field over the last several decades. And these findings are consistent with inequities in academic medicine more broadly within the United States across all of division and department. Interpersonal and institutional gender bias, difficulty balancing demanding of family with academic advancement, and differences in negotiation skills are key factors that should be, the focus of policy intervention. And national and institutional leader in ID should develop and implement policy and demand systemic change in the highest level to correct this persistent disparity with the urgency it requires. So another thing that I wanted to stress is the importance of sisterhood. And I put together here some, picture that I could find from women in our division. And I do have to say how important it has been to me, to have the support of women and my friends within the division that always sustained and, are able to go for happy hours and kind of share the experience. And I do really think that we need to do the best job we can to support each other, to promote each other, to nominate each other for awards and opportunity. And because every time two women put each other down, a man wins, right? So there is nothing to be gained of not helping each other. And this is something that I think we need to realize and do the best job we can. And I am a big fan of Rupi Kaur, who is an Insta poem. And I went to see her with Danielle Campbell. I don't know if she made it here last year, and Melanie Harris. And she was phenomenal. And I love all of her like little quotes about sisterhood and women power. Okay, so we do have great, some time for discussion. And I think there is quite a bit of stuff in the chat which I haven't read. So basically the question that we have right now is, what policy within your division, department, medical school could be changed or created to improve gender disparity in academic advancement? I am part of the Gender Equity Committee of the department. So if you have any ideas, I will take note and I will make sure to try to bring them up.
And maybe while people are thinking and have comments and questions, I'll just review, some of the things that have been put in the chat. Natasha wrote, why aren't service activities public? This should be collected and distributed so everyone can review. Samantha said, yes, negotiation is honestly incredibly confusing because there's no information on what is possible. So going back to that transparency concept, not only on service activities and other unpaid activities that people are doing, but also on not only salary, but the entire package, like Sara mentioned. Jennifer said, also, it's hard to get more female mentorship while also getting women to be less overburdened with public service. So going to the quote unquote minority tax, as it's sometimes referred to, in terms of, wanting to have people who have lived experience contribute to the solutions. But if we are doing that, we should pay people for those contributions and not just have them volunteer to be on JEDI committees or gender equity committees without compensating them in some way. Can't wait to see more. Judy said, can't wait to see more on intersectional data. Sisterhood is the best. We're so badass. Yes. There's also power in numbers. So totally agree. Using collective bargaining, loosely defined, is also another great approach. Anita said, I'm struggling with how much we as women more than men step forward for the collective good and inevitably have more unpaid labor put on us. So going back to why that is, how we could change that, having it be transparent, having it be potentially assigned versus volunteer, paying for it and not having it be unpaid. Lots of people seconding and thirding what Anita said. And then part of mentorship is providing access to the kind of insider information needed for successful negotiation and advancement, from Angela. Yeah. So great, really insightful comments. And maybe if we unshare and we can open it up to
and maybe let's stop recording so that, maybe we, the discussion